On over to this conversation now, because a new G20 Inequality Committee report warns that global inequalities are worsening health crises like HIV and TB and threaten future pandemic preparedness. It urges leaders to address debt, boost local medicine production, and support community-led health systems. Dr. Matthew Kavanagh from Georgetown University joining us to discuss the report's implications for South Africa as well as the G20. Professor, thank you so much for the time. You're in South Africa now and all the way from Georgetown University, of course, and very important conversation here to really be had. And I was just wondering when I first read this report how we thought that COVID-19 would have just broken the back of all of this. We would have understood things better, and yet it persists. Why?
Thanks so much for having me. We are really worried, actually, that the world ends up as or more vulnerable to pandemics today than we were before the start of the COVID-19 pandemic. And that's because while we have remarkable science that is so effective at stopping disease, we can detect outbreaks within hours often. But we're still seeing more and more pandemics. We've not only seen AIDS, we've seen COVID-19, but we've also seen Mpox. We've seen continued outbreaks of Ebola. And so what we found was that there is a cycle between inequality, high rates of inequality, and pandemics. That actually pandemics are more likely when inequality is high, and that when those outbreaks become pandemics, they're likely to be more dangerous, more impactful, more disruptive, and that pandemics themselves cause more inequality because some people are able to exit, some people are fine, but many people at the bottom are not. And so as that happens, what we see is that it fuels this cycle and we get these continuing cycles of pandemics and response.
Yeah, and in so doing, I mean, even the report says, and it's a line that I read yesterday, but I just want to read parts of it again. Future disease outbreaks are inevitable. AIDS remains a pandemic. The impact of COVID-19 continues to reverberate. Humanity is in an era characterized by high and persistent inequality and accelerating risk of disease outbreaks and pandemics. So we're going to continue to have this. This is not going to be a one-time thing, and you could get another breakout of any sort happening very soon. Why are nations sort of, shall we say, perpetuating the thought of inequality? Is it a lack of care for other nations maybe, or is there just not a more concerted effort on making a well-rounded solution here?
You know, it's a great question, and what we are seeing is that outbreaks are happening more and more frequently because of all sorts of reasons. But outbreaks do not have to become pandemics. They don't have to become the level of crisis that they have become, and that is largely driven by inequality. What we're seeing is that kind of several things happen all at once. That when there are kind of disease outbreaks and they become pandemics, some people are able to exit. And so where you've got deep inequality, what our report finds is that we've seen higher rates of HIV, higher rates of HIV infection and death, higher rates of COVID-19 in countries with more inequality. And that's because inequality undermines trust, it undermines effective policy, and it matters a lot when some are affected, but others can exit and they are just fine. And so the pressure on really solving the problems decreases. It also undermines our politics. It creates a politics in which there's very little pressure to actually solve these problems because so much of the wealth and the power is concentrated. You know, my colleague Michael Marmot, who works on the commission, said yesterday at the launch, you know, the rich, had a very good COVID-19 pandemic. There are more billionaires at the end of the pandemic than there were at the beginning. Yeah. And so we've got to be able to address that as a core issue.
Yeah, and I mean, the report then goes on to recommend sort of regional production, as it were, of long-acting AIDS medicines and pandemic therapies. I mean, here in South Africa alone, we've already gone on to be the first African country to accept a particular drug as well that would help in the prevention of HIV and AIDS. So that fight continues. And then the question mark just becomes the local production thereof. Do you think that that's a message that needs to go a little bit further and wider to ensure that we don't have a situation where other countries have a better pandemic than others?
That's exactly right. And as I said at the beginning, one of the things we find is that the science of fighting pandemics has never been better. And yet we've not only got inequality within countries, you've got a lot of inequality between countries. And so millions of people died during COVID who didn't have to, because low and middle income countries, especially countries in Africa, didn't have access to COVID-19 vaccines, while countries in the north had more vaccine doses than they knew what to do with. And so what we've got to do is we've got to get to a place where we're using technology breakthroughs globally to actually stop the pandemic. It doesn't matter if you have amazing science, breakthrough drugs, if they're not actually used to stop the pandemic. Because if you're not stopping it, if you're not getting those drugs to everybody, then what you get is, for example, the rise of variants, the rise of dangerous new versions of the drug, of the virus that matter for everybody. And so you mentioned lenacapavir, which is a really important new HIV medicine, and it's a good case in point. South Africa has been leading, the first African country in the world to approve this new long-acting injection. It's 2 shots a year, and it stops HIV transmission. That's remarkable. But right now, there's only one company in the world that's making that drug, and that company is based in the United States. There's a handful more that are going to be making it soon, but so far that company hasn't granted the license to South Africa, for example, to make it for itself. And so long as we have a situation where the kind of concentration of the production of medicines is only in a handful of countries because of intellectual property rules, we know that when the next outbreak comes, we'll see the same kind of thing happen. And so what we should be doing is investing, and this is where the G20 matters quite a bit, we should be investing in production in Africa, Asia, Latin America of all of the best anti-pandemic medicines and vaccines. And then when the next pandemic comes, we'll be far more ready. We can't count on a few countries to share doses. That's a failed strategy.
Yeah, it's a failed strategy we've seen actually happen over the last couple of years, in fact, as well, right? Sovereign debt is the key factor that hinders a lot of the global south, really, when they're trying to have pandemic preparedness in any way. So let's unpack a little bit more about the G20's aid in all of that. And some leaders who will then go on to say, well, I've got austerity measures that I need to put in place. I need to cut budgets, unfortunately. How do they play a role in ensuring that the inequality, however, doesn't spread when it comes to medical illnesses and pandemics?
One of the things we know is that in a pandemic, if some countries are able to respond and other countries are not able to respond, that helps nobody. Because in a pandemic, it's inherently global. And so if you've got an out-of-control outbreak in one country, it's going to spread to the next country. And so one of the things that the report looks at is we say, why is it that some countries are so unable to respond to pandemics at this moment? And in fact, what we find is not only do some countries not have enough fiscal space, as economists call it, to be able to, when the pandemic hits, be able to surge not only medicine, but all sorts of interventions to stop the pandemic. Not only is that true, but it's more true now than it was at the start of COVID-19. $3 trillion in debt is being held by developing countries right now who are suffering, and therefore they're cutting their health budgets. But you know what else they're cutting? Is they're cutting, as you mentioned, the austerity piece, they're cutting their education budgets. They're cutting their housing budgets. And one of the things that the pandemic report shows is that the way inequality plays out is what we call the social determinants of pandemics. That it matters a lot what kind of housing you have. Because if you've got a vaccine, or if you've got a pandemic of an airborne disease, overcrowded housing is a clear determinant of further spread. The same is true on HIV, the same is true on any number of things, that housing matters, that education matters, and of course access to medicines matters. For that, you've got to have the resources. Helpfully, South Africa has put this on the G20 agenda. And so the G20 has the ability to call for what we're arguing, which is a standstill on debt. That through to 2030, those countries that are experiencing high levels of debt that can't invest in fighting pandemics, give them the space to do so up to 2030 by pausing their debt repayments until such time as we can move forward. And that's the kind of thing that the G20 could do. The international financial institutions like the IMF could back it, and that could be transformative and leave us more prepared for the next pandemic instead of where we are right now, which is less prepared because of all the debt.
And it needs to happen fast. Professor Kavanagh, I really appreciate the time. Thank you so much. I believe you've also given this report to President Cyril Ramaphosa.